Good evening, Chairwoman Colkhurst, Vice Chairman Perry, and esteemed members of this committee. My name is Noah Torres, and I'm a researcher at the Texas Public Policy Foundation. I am testifying in favor of SB 1318, which seeks to restrict the use of non-compete agreements for healthcare practitioners. 45% of physicians in the United States are bound by non-compete agreements. These agreements restrain physicians following termination of employment by restricting their labor mobility according to geographic or temporal terms. In Texas, non-compete agreements may not prevent physicians from having access to patient lists or records, continuing to provide care, and must have a reasonable buyout fee. Despite these requirements, temporal and geographic restrictions may be so extreme and buyout fees may be so high that physicians are either forced to remain in an unsatisfactory career or relocate their livelihoods far from their current patients. Thus, non-compete agreements contribute to broader problems of provider group consolidation, physician maldistribution, patient access to healthcare, and competition and innovation in medical practice. Employers tend to justify their use of non-competes by claiming they protect intellectual property, insulate physicians from poaching, or support human capital investment. Yet, in healthcare, the negative consequences of non-competes outweigh most benefits. By preventing physicians from departing their employer via high buyouts, non-competes cement hospital status as both the dominant providers of care and the dominant employers of physicians, creating a sort of company town environment that allows hospitals to freely raise prices and suppress physician salaries. Of note, 61% of Texans live in highly consolidated healthcare markets, all clustered in metropolitan areas. Further, if departing physicians abide by non-competes and relocate far from their patients, the physician-patient relationship may be severed, with less than half of patients being able to follow a physician if they move 40 minutes from their location. By limiting geographic restrictions to 5 miles, capping buyouts, and renting.
Yeah, so if you could, Senator Hall is going to ask you a question.
Mm-hmm.
Got a question?
No, go to the question. I got a comment.
Okay, so wrap it up in like a sentence.
These agreements restrain physician mobility, detach patients from their physicians, inhibit innovation and formulation of new practices, and ultimately is bad for patients and for physicians alike.
That's a good synopsis right there.